Known problems with the United States Centers for Disease Control's pneumonia, influenza, and COVID-19 death numbers, sometimes abbreviated PIC or PIC. It's a 1,000-word summary that I wrote of our much longer article on these issues. You can go to it here or here. This is the actual paper. This is really long, so I'm giving a short summary. So I'm basically going to read the summary of the key points and stop at one or 2 points to add a couple of other comments. So key point summary. A number of CDC data presentation and statistical practices since the start of the COVID-19 pandemic in early 2020 have not followed common scientific and engineering practice. Several problems with data presentation and analyses for pneumonia and influenza death numbers, which have been merged with COVID-19 death numbers in the FluView website, predate the pandemic. Before the pandemic, March 2020, the non-standard data presentation and statistical practices appear to increase the number of deaths attributed to the influenza virus and imply the death counts are certain, whereas substantial uncertainty exists due to uncertainty in the assignment of the cause of death and other causes. Since the pandemic, these practices appear to do the same for SARS-CoV-2 and COVID-19. Remarkably, the CDC had at least 3 different numbers for deaths attributed to pneumonia and influenza before 2020. The leading causes of death report count with 2% of deaths, about 55,000 per year, attributed to influenza and pneumonia. The influenza virus deaths model, with about 55,000 deaths per year attributed specifically to the influenza virus, and the FluView website count with about 6 to 8% of deaths, about 188,000 per year, attributed to pneumonia and influenza. This is one of the most striking problems with their data presentation and analysis. So this is the FluView website today, December 21st, 2021. We're well into the pandemic, which you can see here. They merged the COVID death numbers in with the historical pneumonia and influenza death numbers. The red line here, the scary red line, is the number, or percentage actually, let me go into that, of deaths attributed prior to the pandemic to pneumonia and influenza. And since the pandemic, they have added in the reported COVID-19 deaths, at least according to the CDC's National Center for Health Statistics. Now, what's remarkable here is you'll see the scale here is percent of deaths in the whole U.S., and this varied prior to the pandemic between about 6 and 8%, with occasional surges in the midwinter, December, January. 6 to 8% of total deaths. And if you actually look at the data files for this, which you can get by poking around up here, they appear to be listing about 188,000 deaths per year as caused by pneumonia and influenza. And let's look at this label here. It says percent of deaths due to PIC, due to, which means caused by. There's no qualifications here. They are simply saying caused by. So this appears to be, and sounds like, to all intents and purposes, a count of deaths caused by pneumonia and influenza prior to the pandemic, and pneumonia, influenza, and COVID now. Well, let's look. This is CDC, a document again, the National Vital Statistics Report on 10 leading causes of death in the U.S. in 2016 and 2017. And you'll see they have all causes. If you go down to number 8, you'll find influenza and pneumonia, the count of deaths caused by influenza and pneumonia. 8th leading cause of death, 2%. You can see right here, 2% of deaths, not 6 to 8% in 2017, are caused by pneumonia and influenza. 1.9% right here in 2016. Other years are similar. Here they give the exact count, so you don't have to go through data files. That's 55,672 in 2017 and 51,537 in 2016. So these differ from the numbers and percentages reported here in FluView by a factor of over 3. And in our article, we go into a lot of details as to exactly why that looks like this is being done, although we've not been able to get a specific, explicit confirmation of what the CDC is doing. Think about that. They have two different numbers. They don't differ by a few percent, maybe some counting or tabulation issues. They differ by a factor of over 3. And there's nothing here in this graph, in any of the labels for it, the title, anything to indicate why this is. Same way here. If you look in the fine print, there is a possible explanation. But that explanation raises very substantial questions about the errors on these numbers. And notice that there are no error bars. These are exact counts. It implies they know how many people died from each cause and the total number in the U.S. to the last digit. That's what scientific and engineering practice is. You're supposed to put error bars on these if there's any uncertainties. Of course, there actually are uncertainties. Our total annual counts of deaths are not perfect. There's actually problems with them. The ones that have been detected are at the range of maybe 1,000 miscounted deaths per month. Actually, people who are alive who are added to the so-called deaths master file every month in audits that have been done of it. That's not a very large error, but it's not reported here. And many studies show large uncertainties in the assignments of the cause of death, particularly with pneumonia and respiratory illnesses. Well, let's get back to the summary, and I'll keep going. And I probably won't have too many more comments. The FluView number differs from the other two death numbers by a factor of over 3. The probable reason for this difference is that, according to the FluView technical notes, FluView counts deaths where pneumonia or influenza is listed as a cause of death, whereas the leading cause of death report, according to the technical notes, counts only deaths where pneumonia or influenza is listed as the underlying cause of death. This probably reflects a large uncertainty in the assignment of the cause of death in respiratory illness cases. Indeed, the underlying cause of death may be ill-defined in these cases. The CDC's excess death estimates on their excess deaths website does not report any standard goodness of fit statistics, notably the coefficient of determination, often known as R-squared, and the chi-squared goodness of fit statistics. Our analysis shows that different models with the same goodness of fit statistics give different estimates of the number of excess deaths, varying by up to 200,000 deaths in 2020. The CDC website does not report this systematic modeling error. The CDC appears to have chosen a set of parameters for the Nufali-Farrington algorithm used by the CDC to estimate excess deaths that gives a lower R-squared value for goodness of fit than other choices of those parameters and a higher estimate of excess deaths, whereas common scientific and engineering practice would be to use the models with the best goodness of fit statistics. For example, the R-squared closest to 1.0, which is a perfect fit. The Nufali-Farrington algorithm is an empirical trend detection and extrapolation model. So that would be kind of like a fancy version of taking a ruler and running the ruler through the data to point and just extrapolating along the edge of the ruler. Okay, it doesn't model the sort of the underlying medical or biological causes of that. So let me repeat that again. The Nufali-Farrington algorithm is an empirical trend detection and extrapolation model theoretically incapable of accurately modeling the aging baby boom population, which would be expected to produce excess deaths in recent years. Nor is it able to explain the puzzling near stop in the increase in deaths per year reported in the immediate pre-pandemic years 2017 to 2019 despite the aging population. So the number of deaths per year began rising quite rapidly in 2010, and this is likely because of the aging baby boomers who were born between about 1947 and 1964, and it rose steadily until about 2017 and almost flattened the last 3 years before the pandemic. That's not what you'd expect, but that's what the CDC's official data shows. The CDC does not publish, as of to December 2021, years of life lost estimates. This would presumably be on the excess deaths website, which include increases in suicides, homicides, and other adverse effects from the lockdowns, nor systematic modeling errors on the YLL estimates, which are likely to be large if they did do this. YLL in principle can illustrate the difference between a disease that largely kills those nearing death anyway, versus a disease that easily kills the healthy. Just counts of the number of deaths can't really do that. The CDC issued a COVID death certificate guidance document in April of 2020 that appears to change the standards for assigning the underlying cause of death, which is often abbreviated UCOD or UCOD, from the pre-pandemic practice for assigning the underlying cause of death for pneumonia and influenza, making COVID-19 the underlying cause of death in many cases where the person who died had serious pre-existing conditions such as chronic bronchitis, emphysema, heart failure, etc. The deaths, we think, are counted in FluView, but not in the leading causes of death report. There does not appear to have been any public comment on this guidance document to date. In general, the CDC does not report statistical errors, systematic errors, or estimates of biases in pneumonia, influenza, and COVID-19 death numbers. They do not report any monitoring of the effect of their guidance documents or other directives on the assignment of the cause of death by doctors, medical examiners, and others. These issues are sometimes shared with other government agencies, such as the U.S. Social Security Administration, the SSA, and the U.S. Census Bureau, which work closely with the CDC, particularly on death numbers. Death counts for individual causes and all-cause deaths are frequently reported as precise to the last digit without any statistical or systematic errors, despite both known and unknown uncertainties in counting deaths, such as missing persons, unreported deaths due to deceased payee fraud, the roughly 1,000 living Americans incorrectly added to the government deaths masters file, the DMF, each month for unknown reasons, considerable uncertainties in assigning the underlying cause of death by coroners and doctors. Similarly, raw counts, adjusted counts, and estimates, often based on incompletely documented computer mathematical models, are often not clearly identified as such. The deaths master file with names and dates of death of deceased persons is exempt from the Freedom of Information Act, FOIA, and unavailable to the general public, independent researchers, or even other government agencies such as the IRS. This confidentiality of data makes independent verification of many CDC numbers, such as the excess deaths numbers tracked during the COVID-19 pandemic, all but impossible to verify. This omission of common scientific and engineering practices raises questions about the accuracy of the CDC's data, conclusions, and public health policies in a number of important areas, including the COVID-19 pandemic. The non-standard data presentation and statistical practices appear to increase the number of deaths attributed to the influenza virus, and implied death counts are certain, whereas substantial uncertainty exists due to the uncertainty in the assignment of the cause of death and other causes. Since the pandemic, these practices appear to do the same for SARS-CoV-2 and COVID-19. At present, virtually no deaths are attributed to influenza virus at all since the pandemic. You can read the full article, the full research paper, which is quite long. It's over 10,000 words, 13,000 words with all references and everything. It is found on Authoria. It is Improving CDC Data Practices, Recommendations for Improving the United States Centers for Disease Control Data Practices for Pneumonia, Influenza, and COVID-19. And this is an updated version in November, which incorporates a few changes, some feedback we got on the influenza virus deaths model. So it's more precise in addressing a number of issues. This is the one you should read. There's an earlier one from July which doesn't have those revisions, but this has the most up-to-date information and analysis that we have. That's the end of this summary. This concludes this video presentation. If you like this video, please click like. Please click subscribe and the notification bell if you would like to receive more content from us. You can avoid internet censorship by subscribing directly to our RSS news feed. Please consider sharing the link by email and on your website or blog, in addition to liking, upvoting, or sharing on increasingly censored, advertising beholden, big company social media. We have encountered such censorship. Mathematical software is developing algorithms and software to automate data analysis, reducing the risks of costly errors and increasing the predictive power of the results. You can support our work financially by subscribing on our Patreon page, https://www.patreon.com/mathsoft, or scanning the QR code in the lower right corner.